Hello, I'm Dr. Stu Silverstein from Medhumor Medical Publications and the author of Laughing Your Way to Passing the Pediatric Boards. We've begun a little video series here to help you prepare for the boards and how to keep important information straight. And we're going to begin with a series on allergy and immunology. And today we're going to talk about All in the Family, which is not a show from the 70s, but a talk about how infants and diet and other factors leave them vulnerable to allergies and some of the myths and some of the changes that have occurred over the years. Now, pediatrics and medicine in general, just like the 1984 book and novel by George Orwell called 1984, which, if you recall, if you read this book, history is rewritten and changed, and the facts, yesterday's facts are today's myths, and the same thing applies to pediatrics and the boards. So if you're going to be taking the boards in 1984, great. If you're taking them today in 2017, you need to have other information. So let's go over some of this important information for infants. Atopic dermatitis, again, you see it in infants as atopic dermatitis, in children allergic rhinitis, and later on in children and adolescents that's asthma. And that's sort of a triad. It's called the atopic march. They sort of go together. So any child on the boards who's presented with atopic dermatitis know that they're also likely to have allergic rhinitis and asthma. What's the most important component is parental history of atopy. So they might mention the parents in history, and that's important. So, for example, if one parent has a history of atopic disease, the child is at 50% risk for atopic disease. If two parents have a history of atopic disease, then there's a 70% chance the child will have atopic disease. And if three parents have atopy, then there's probably 150% chance. In today's boards, that might be a fact, it may be percent of people. You might be given a patient who has got three parents, who knows? But regardless, watch for the parent history. But genetics is not the only contributing factor. There's environmental influences, of course, and watch for those in the question. Watch for mentioning indoor pets, cigarette smoking, history of bronchiolitis, particularly RSV. That increases risk, or some factors may decrease risk. Just watch for those. Now, an important thing to remember is maternal diet. Back in the day, maternal diet was important, an important factor in whether a child will develop atopic disease. Today, that's not true anymore. So again, the history books have been rewritten. And if your question on this concept, the correct choice will be for the mother to have a regular, healthy diet without any dietary limitations. They can have a peanut butter sandwich, they can have a peanut butter milkshake, whatever they want to have is fine. It has no impact on the child's risk for developing atopic disease. In fact, what was once felt to be gospel was to delay solid foods as long as you could, but delaying foods after beyond 4 to 6 months does not prevent atopic disease. Therefore, holding off on fish, eggs, peanut butter will not prevent allergies. And in fact, current research suggests the absolute opposite. In fact, there's been studies of Israeli children who eat a particular food called bamba, which is basically like peanut butter cheese doodles. And if you've eaten these, they're pretty addictive, and you will gain weight if you eat these. But Israeli children eat them, and therefore they're exposed to peanut butter pretty early in life. And it's been found that Israeli children are at lower risk for developing peanut allergies. So remember that. On the boards now, exposure to peanut butter and other items might decrease the risk for developing an allergy. Whereas in 1984, it would have increased the risk. Of course, nothing's changed except the books themselves. And we hope that you found this useful. And like us on Facebook, follow us on Twitter, and subscribe to our YouTube channel. And let us know what kind of videos you'd like us to produce to help you pass the boards. But right now, we'll be going through allergy and immunology. Thank you very much.